Welcome to the deep dive. Today, we are cracking open a legal filing that honestly reads like the blueprint for a huge systematic fraud operation.
It really does.
Our mission is to dive into this complex civil complaint from GEICO, and just as important, it's Evidence Exhibit 1, which is just this massive stack of billings, and pull out what's really going on.
And this is an extraordinary one because the documents allege a really sophisticated fraud network, one that's operating at, well, at an industrial volume.
Right.
We're looking at a case centered on a provider, Pulse Medical Care, PC, and its principal, Dr. Qureshi,
Yep.
along with a key non-licensed individual, a man named Irshad Syed. The insurer claims this whole thing began way back in 2018, and, based on the records, it continued right through early 2025.
Wow, so that's a long time, and the money involved.
The alleged damages GEICO is citing here are massive. They exceed $1.6 million.
That timeline, more than 6 years of alleged continuous operation, that's a huge piece of this puzzle. And it's all built on exploiting New York's no-fault insurance framework.
Yes, that's the strategic engine for the whole thing. New York law requires drivers to have personal injury protection PIP benefits, which provides up to $50,000 for medical expenses.
Regardless of who was at fault in the accident.
Exactly. And the key point here, the thing that makes this kind of alleged fraud possible, is that the provider bills the insurer directly.
So the patient almost never sees a bill.
Rarely, if ever. They don't scrutinize the cost, which makes that $50,000 policy limit a fixed pot of money for the provider to just access directly.
So if the provider knows they have a $50,000 limit that the patient isn't going to argue over, the incentive isn't just to treat the patient.
No.
It's allegedly to drain that policy as fast as possible.
Precisely. And that leads us to the foundational legal vulnerability GEICO cites here. It's a licensing rule.
Okay, what's the rule?
To get any no-fault reimbursement in New York, a medical corporation has to strictly comply with state licensing, which says only a licensed physician can own or control it. GEICO alleges Pulse Medical violated this rule from the get-go.
Which would mean?
It would mean all of their bills are ineligible for payment, period, regardless of whether the treatment was even necessary.
Okay, so let's unpack the people who were allegedly running the show. I mean, for a systematic enterprise like this, you need more than just a doctor and a billing computer.
Absolutely. The documents detail 3 core alleged roles. First, you have Pulse Medical Care, PC, which is the central billing entity.
Right.
Second is Dr. Adnan Qureshi, the licensed physician who technically owned the practice. He's alleged to have used it specifically as a vehicle for the fraudulent billing.
And then the third person, Irshad Syed.
Mm-hmm.
He sounds like he was the bridge between the medical side and getting patients in the door.
That's where the whole alleged scheme gets really integrated. Syed is described as a non-licensed provider who was supposedly key in cultivating this network of clinics.
But there's more to his role, right?
Yeah, and this is fascinating. Syed was also the director of marketing for the Munawar law firm, PLLC.
A law firm.
A personal injury law firm, which in turn represented over 100 of the individuals who were allegedly treated by Pulse Medical. That tight relationship is absolutely central to GEICO's claims.
So the law firm allegedly provides this steady stream of clients, and Syed manages the flow.
Exactly.
And that would explain why Pulse Medical didn't just operate from a single dedicated location.
Exactly. The complaint describes their operation as itinerant. They were allegedly moving around to different shared spaces, mostly in Queens, the Bronx, and Brooklyn.
And these places are described as, what, no-fault medical clinics?
Yeah, one-stop shops where patients could be sent to see a chiropractor, a physical therapist, and a doctor like Qureshi, all under one roof, all designed to, efficiently exploit the system.
This sounds less like a real medical practice and more like a high-volume insurance processing center. But how did they get the patients? What was the cost?
That's where the alleged kickbacks come in. The complaint details these financially incentivized referral arrangements. Unlicensed laypersons were allegedly in charge of the patient base, and payments to get these patients were disguised as, legitimate business costs like rent.
But they were really kickbacks.
In reality, they were alleged kickbacks to gain access to insureds who had just been in accidents. This created a huge patient acquisition cost that they needed to cover.
So if you pay a ton of money up front for a patient, that patient immediately becomes a liability you have to get revenue from, and fast.
Exactly. And the complaint points out that patients didn't have scheduled appointments specifically with Dr. Qureshi. They were just, directed there. The goal wasn't patient care. It was to start maximizing charges immediately.
Which brings us to the services themselves. If the whole model required quick money gank, the initial services must have been inflated from the start.
And that's what the billing data shows, a pattern of alleged upcoding on the very first examination. Almost every insured person got an initial exam, but the codes used suggest the services were way more complex than needed for, typical soft tissue injuries.
The sprains and strains from a fender bender.
Right.
So give us an example of that upcoding.
Okay, take CPT code 99203. That's a new patient visit, typically bills for around $100 to $200.
Okay.
The code requires the doctor to spend at least 30 minutes face-to-face with the patient and do low-complexity medical decision-making. If the complaint's right, and these were mostly minor sprains, billing for 30 minutes of a doctor's time for that, it's excessive.
And sometimes it went even higher, to CPT 99244.
Right, that's a consultation code billing out to almost $240, and that represents at least 40 minutes face-to-face with moderate complexity decision-making.
So the core allegation is just misrepresentation. The injuries didn't justify that level of time or complexity.
Exactly. They were allegedly billing for a complex diagnostic session when the actual visit might have been, much, much quicker.
And after that initial allegedly inflated exam, the records show Pulse Medical just layered on all these expensive add-ons.
Yeah, one of the most common was CPT 99358 for orthopedic aids and testing. That added another $200 to $280.
So why is that a red flag? Billing for testing after an injury sounds normal.
Well, it highlights the importance of what are called medical bundling rules. A standard physical exam for soft tissue trauma has to happen anyway. The fee schedule generally says that this kind of testing should be included. It's reimbursed as an element of that initial exam.
So billing for it separately is.
It's alleged to be fraudulent overbilling. You're essentially charging twice for work already covered by the first code.
Okay, let's look at the diagnostic ultrasound, CPT 76881. The charges on that were all over the place, from a couple hundred up to over $1,000.
And this is where GEICO really pivots its argument from just billing rules to established medical necessity. They bring in external medical authorities to argue these ultrasounds were often just completely unnecessary.
What do those sources say?
It's very specific. The complaint notes the American Institute of Ultrasound Medicine found insufficient evidence for using this kind of ultrasound for spinal conditions involving discs or facet joints. They call it investigational.
So not standard practice.
Not at all. And what's more, the American College of Radiology guidelines for low back pain, they don't include ultrasound as a recommended option.
So GEICO is arguing this isn't just a billing dispute, it's a violation of accepted medical standards.
Precisely. And to hammer that home, the New York State Workers' Comp Board guidelines specifically state that diagnostic ultrasound is not recommended for patients with back pain. The fact that they allegedly use this high-cost, non-recommended test so often is a huge pillar of GEICO's argument.
Okay, so we've got the patient acquisition strategy, the initial billing inflation. But if your goal is to burn through that $50,000 cap quickly, you can't just rely on $200 exams.
No, you can't.
You have to escalate. You have to fast-track patients to expensive, invasive procedures.
And this is the alleged strategic acceleration they needed to hit the cap. I mean, standard care for soft tissue injuries requires you to try conservative treatments, first physical therapy, chiropractic care, pain meds.
And most sprains and strains get better with that.
They do. Invasive procedures, like surgery, should only happen after that conservative care has clearly failed.
But Pulse Medical allegedly just skipped that whole phase.
Yes. They routinely billed for percutaneous discectomies, or PDs. For listeners, this is an actual surgical procedure billed with high-cost codes like 62287, which is up to $5,700, or 63075, which is almost $4,000.
And the shocking part here is the timeline.
The timeline is incredible. The complaint gives specific examples where insureds got a PD less than 2 months after their car accident.
Less than 8 weeks, from a fender bender to a $5,000 spinal procedure. That seems almost medically impossible to justify.
It's a massive red flag. They mention one person, insured CJ accident on July 5th, 2021, and a PD was allegedly performed on September 3rd, 2021. You just can't claim a legitimate course of conservative care was tried and failed in that short a time.
And they allegedly paired those with another procedure.
Often. Intradiscal electrothermal therapy, or IDE, that's another code, billing up to $5,400. And again, the medical consensus is very skeptical.
What do the authorities say?
The Centers for Medicare and Medicaid, CMS, they found that evidence just doesn't demonstrate that these thermal procedures improve health outcomes. Aetna considers it investigational, yet Pulse allegedly billed for it all the time.
And was there an inflation tactic even within the surgery billing itself?
Absolutely. One designed for multi-level procedures. The complaint details an alleged profit-maximizing move where instead of using the lower rate follow-up code for the second or third level of a PD,
Which would be the correct way to bill it?
the correct way, yes, they allegedly just billed multiple units of the higher-paying initial count. It's explicitly designed to maximize the total bill for a single procedure. It turns it into a profit multiplier.
All of this dramatic medical escalation brings us to Dr. Qureshi's qualifications. If we're talking about surgery, was he board certified to do this?
And that is the central point here, not just about the alleged fraud, but about patient safety. The complaint alleges Dr. Qureshi did virtually all of these PDs.
Nice.
His only board certification is in physical medicine and rehabilitation. He's a physiatrist. He is not a board-certified surgeon, nor does he have a subspecialty in interventional pain management that covers these surgical procedures.
Wait, a physiatrist, a rehab specialist, is performing complex spinal surgery. That raises huge concerns about patient risk.
It does. The complaint explicitly says that performing these procedures without the right surgical training place the insureds at significant risk of complications. They mention things like nerve root injury and infection. It's a major element of the claimed recklessness.
So this whole detailed structure, from patient acquisition to the upcoding of surgeries, it brings us to the final legal claim. GEICO's case is basically that every single bill Pulse Medical ever submitted contained fundamental misrepresentations.
And those misrepresentations boil down to three things. First, Pulse Medical's foundational legal eligibility to even receive benefits at all.
Because of the alleged control by a non-licensed person?
Right. Second, the lack of medical necessity for the services. And third, the deliberate exaggeration of those services through upcoded CPT codes just to inflate the charges.
And the ultimate legal hammer here is the Federal IKEA Act. For listeners who aren't familiar, why bring GEICO into a no-fault insurance dispute?
GEICO alleges violations of the Racketeer Influenced and Corrupt Organizations Act because they claim this was an ongoing enterprise that existed just to commit fraud.
And the underlying crime.
This specific predicate act is repeated mail fraud. The complaint says using the U.S. mails to submit thousands of these allegedly fraudulent charges over 6 years constitutes a continuous pattern of racketeering activity. The business model, according to GEICO, was the racketeering.
So the stakes couldn't be higher. GEICO isn't just asking for their $1.6 million back.
No, they're seeking punitive and treble damages against Qureshi and Syed personally. Plus, they want a declaratory judgment that Pulse has no right to payment for any pending bills, which would effectively shut the entire operation down.
It just shows the immense challenge insurers face. When a fraud scheme is this organized, this persistent, and so successful at masking what are alleged to be high-risk, unnecessary procedures, the only path forward is to challenge the very foundation of the provider's existence under federal law.
It really is.
The sheer persistence and detail in that complaint, spanning 6 years and just countless billed events, it really highlights the effort required to distinguish legitimate care from these massive organized billing patterns. What stands out to me is the financialization of patient access. The idea that patients themselves just became an acquisition cost.
An acquisition cost that necessitated accelerating these highly expensive procedures.
Exactly.
And it's a perfect example of how New York's no-fault rules, which are meant to get people necessary treatment quickly, can be exploited. That immediate availability of $50,000 becomes a fixed target, and the regulatory environment itself becomes a vector for alleged systemic fraud.
So here's a final thought for you to consider. The central conflict here, it isn't just about money. It's about the strategy of medical specialization. When a complaint alleges the continuous use of a specific, highly regulated medical certification like being a physiatrist to allegedly justify and perform complex procedures traditionally reserved for surgeons, all to quickly burn through an insurance cap. Well, that blurs a lot of lines. What's the real difference between aggressive billing and alleged systemic fraud in these high-volume health services? It seems the answer lies in whether the medical necessity was real or just a means to unlock a payment cap before anyone could scrutinize the risk.